Good evening, ladies and gentlemen. My name is Adam Miller. I am the Assistant Director of Event Operations for the Enrollment Management Team here at UC Merced. I'd like to welcome you into tonight's webinar. We are going to pause for a few minutes to let everyone join the webinar. We will be back with you in just a few moments. Well, good evening, ladies and gentlemen. Thank you for taking the time to join us at tonight's webinar. My name is Adam Miller. I am the Assistant Director of Event Operations for our Enrollment Management Team here at UC Merced. On behalf of everyone that will be on screen tonight and behind the scenes tonight, I'd like to thank you for joining us tonight. You're here tonight for the Your Wellness webinar covering our UC health insurance plan, as well as immunizations and other health-related topics while you are here on campus. So here at UC Merced, we do have a very beautiful health and athletics center. It is located in the front portion of our campus right as you come in from the parking lot. The Student Health Center is located on the second floor of the Health and Athletics Center. They're open Monday through Friday, 8 a.m. till 4:30 p.m. And you can call into the Student Health Center at the 228-2273 number to make an appointment. And you do not need to be on the UC SHIP or UC Student Health Insurance Program to be seen in our Health and Wellness Center. So in appointments, we do have the option for either in-person appointments or telehealth appointments. We do have a nurses clinic on our campus where you can get immunizations, your tuberculosis screening, pregnancy tests, wound care and triage, many other options that you may need while you are here on this campus. Another great thing that we have on our campus is also our counseling and psychiatric or psychology services program through our health center as well. And then we can also do any of the blood lab draws that you need to have done. So it is your one-stop health and wellness center here on the campus. We do recommend, feel free to reach out to them if you do have any direct questions as to what they can and cannot treat. Our local hospital is located just a short 2-minute drive from our campus. So if it is something more serious, we do have the ability to get you to the hospital if we need to. So one of the things that we did want to cover is the vaccination requirements. All students are required to have the Tdap vaccine. I'm not even going to try to pronounce the other vaccines that you need here. But here is the list of all of the requirements of the vaccinations. And then all this is all also posted on our Student Health and Wellness webpage as well. There is a way to apply for an insurance waiver. That off Monday through Friday, 8 a.m. to 4:30 p.m. When you call into the Student Health and Wellness Center, select option 1. And next, I'm going to hand it over to Crystal.
I'm going to go over a few things about the waiver for this year. So the 55-mile primary care provider requirement will be on the fall waiver for 2022. The mandate is back. I do want to let everybody know that this mandate is across the entire UC system. So from UC San Francisco to UC San Diego, the 55-mile requirement is back on the waiver and is mandatory. So that's 55 miles from campus. To fill out the waiver, you must upload your insurance card and your summary of benefits. For students who have Medi-Cal, you do not need to update your summary of benefits because we know that it's a very big booklet. So there's no need for that. We know what the summary of benefits is for Medi-Cal. Now, for your, if you have Medi-Cal, what we do need you to upload will be your health plan card. So for example, if you're in Merced County, that would be the Central California Alliance for Health card and your state benefits card. So it depends which one you have, which is either a blue and white card or the card that has the poppy flowers on it. So both of those cards will need to be uploaded onto the waiver. After you filled out all the information on the waiver, which is basically 7 questions, yes or no questions about your insurance, your cards, and then your insurance ID and some information about you, your birth date and your address, you will submit that waiver and you will receive an immediate email to your UC Merced account. And the email will be labeled pending audit status. Now, it does take 5 to 7 days for that final approval or denial. And that's business days, so weekends do not count. If your waiver is denied for any reason, you can contact the insurance office. Our email address and our phone number is down below. And we can help you to try to get, to try to see why your waiver was denied and try to help get it approved. I do want to state that the waiver deadline is August 1st at 11:59 p.m. The waiver link will be disabled on August 2nd at 12 a.m. So students have until 11:59 p.m. August 1st to submit their waiver. It is a very hard deadline, so please, we ask all students to submit your waiver on time. Like I said before, our email address and our phone number is down below. We do want to let students know to please leave a voicemail in order for us to call back. If you leave a voicemail with your name, your number, and your student ID number, we'll be able to call you back between an hour to 72 hours. I want to say it's sooner, but because the waiver deadline is approaching, we do give ourselves that time. Now I want to go over some things. So eligible insurances for the waiver. We accept Medi-Cal, and your Medi-Cal counties have to be either in Merced, Madera, Mariposa, Stanislaus, San Joaquin, and Fresno County. And your provider must be within 55 miles of campus. So those counties are eligible to waive the insurance, and your primary care provider has to be within the 55 miles of campus. So if you are in, for example, San Joaquin County, as long as your provider is within those 55 miles, you are eligible to waive out of the insurance. Other insurances that are accepted are PPO plans and HMO plans. Now for HMO, it still applies, the rule applies to where 55 miles, to where your primary care has to be within 55 miles of campus. So if you have an HMO plan and say you're in LA County, you will have to contact your insurance and try to find a provider within the 55 miles of campus in order for your waiver to be approved. Now, this is just a brief overview on how to switch your Medi-Cal county to Merced. Now, we do have a generic address that is provided to us that the students can use, which is the 101 Terrace Center, 5400 North Lake Road, Merced, California, 95343. And this is the address that you can give your caseworker. And what you're going to let your caseworker know is that you're attending UC Merced. This is a temporary change, which would be your updated residential address, and you will be visiting home on weekends and holidays. That way they know that you're just attending school and your benefits need to be there while you're attending school. I do want to let everybody know this process takes 3 to 30 business days. So if you are trying to switch your county, we advise that this is done before August 1st and your waiver is submitted before August 1st. If you wait to switch your county till after August 1st and submit your waiver, unfortunately, there's nothing we can do. But once you've switched your address and your Medi-Cal is in Merced, we ask that you please contact Central California Alliance, and I've provided their phone number below, and you request a letter of eligibility. And what that lets us know, that letter states is, yes, the student is in our Merced County medical health plan and they are eligible. And you can request that over the phone and it can be emailed you within 48 hours. And all you would do is once you receive that letter is upload that to your waiver and resubmit. Now I'm going to go over a brief overview of UC SHIP, which is the school's insurance. UC SHIP is an ACA compliant insurance, which meets the needs of Affordable Care Act. The medical and vision plans are through Anthem Blue Cross, and the dental plan is through Delta Dental. All three of these plans are a PPO insurance, and it can be used anywhere in the US, overseas, anywhere Anthem Blue Cross is accepted. So for example, a student is attending UC Merced and say they live in San Diego and they need to see a doctor for whatever reason, they are able to see a doctor in their hometown. This insurance is not just used for Merced. It can be used anywhere. They do not give out physical cards, so you can download the insurance card through either the App Store or Google Play, and the name of the app is Student Health. It has a little cap and gown on the icon. And we do want to let students know that you can use the health center whether you have UC SHIP or your own insurance, whether it be Medi-Cal, United Healthcare, Kaiser. You can be seen at the health center for free. The only thing is that if you have any other plan other than UC SHIP, there might be some out-of-pocket expenses. You know, for example, if you fall and get hurt and you need some crutches, it's a very small amount that you will have to pay. But if you have UC SHIP, then you know, everything is billed to the insurance. Some of the benefits for UC SHIP for vision, it's a $10 vision exam, and you get $120 in allowance for glasses or contacts, and that's a year. A lot of employer plans, you know, you get that allowance for glasses or contacts every 2 years. UC SHIP, it's for once a year. So, you know, you go to the optometrist, you pay $10 for the exam, and so you want contacts, your insurance will pay up to $120 for your glasses or contacts, either or. For dental, you get 2 free cleanings a year, 1 every 6 months, and there is a $1,000 allowance. Once the $1,000 has been used, this is actually incorrect. I should have edited that, but you are responsible after the $1,000. Everything after those $1,000 is the student responsibility. So for example, you go and get a cleaning, and then the dentist tells you, oh, you need to get your wisdom teeth pulled. Your cleaning is for free, so it will not touch that $1,000. So when you go get your wisdom teeth pulled, that $1,000 will be applied to the cost of getting your wisdom teeth out. For medical, you have a $15 copay for doctor visits and a $20 copay for a specialist visit. UC Merced students do not need referrals to be seen by a specialist. So if you see your doctor and you have interest in seeing a dermatologist, for example, you don't need a referral from your doctor. You can actually just call up a dermatologist within your PPO network and be seen there. And I do want to let everybody know, this is in-network provider pricing. Once you go out of network, the prices go up. You can also enroll your dependents in UC SHIP. You must enroll your dependents every semester. Unfortunately, you can't just pay up front for a full year. Every semester you have to enroll your dependents. Our enrollment periods for the fall begin July 15th, and the last day to enroll your dependents for the fall is September 15th. For the spring, open enrollment begins December 15th and closes February 15th. After the enrollment period is closed, you can only enroll your dependents for only life events. For example, we have adoption, a birth, marriage, or loss of insurance. That's the only time after the enrollment closing date that you can enroll your dependents into UC SHIP. You can enroll your dependents through our website. Rates and coverage periods can be found on our website as well. We have the website address there. Everything is done online now, so there's no need to call to enroll your dependents through that website right there, that page. All you would have to do is select the link, I want to enroll my dependents, click here, and it takes you straight to the sign up page. And this is how you can get a hold of us. UC SHIP Insurance, we're open Monday through Friday, 8 a.m. to 4:30 p.m. Our telephone number is the same as the health center, but you will just have to select option number 1. And please, we really, really encourage everyone to leave a voicemail. Again, with your name, your student ID number, and your phone number as well. Or you can email us at insurance@ucmerced.edu. There is 3 of us attached to that email. So it'll either be myself, the insurance supervisor, or our billing and insurance coordinator, or credentialing and insurance coordinator. but we are always there to help with any questions students have.
Well, thank you very much for that, Crystal. We're at the point now getting ready to start answering your questions that you do have. Like I said, be at the beginning, and for those of you that have just joined us, please feel free to ask your questions through the Q&A panel located at the bottom center portion of your screen. We'll select some of those questions to ask live to our group of panelists that we do have with us, or we may respond to it directly through the question and answer tool. We do ask that you please go back through the Q&A tool. Look, we may have already answered your question throughout that. The first question that we do have that we're going to take live is if a student does not currently have the COVID vaccine or does not currently have their COVID boosters, what are their options?
All right, so this is Dr. Brinkup. I am the medical director here at the Student Health Center, and COVID vaccine is a required vaccine for all students entering UC Merced in the fall. Hopefully, most people have had the opportunity to get the primary series and the booster. If you have not had that opportunity, please go out and do it before you arrive on campus. You can get COVID booster at your local public health department. You can get it at all of the big pharmacies, so CVS, Rite Aid, Costco, Walgreens. You can get your primary series and or finish your booster. If you arrive to campus without your COVID vaccine, you can get it at Student Health. So call Student Health, make an appointment, come in that first day, first week, and let's get you vaccinated for COVID. If you need a medical exemption or a religious exemption, go on the UC Merced website, our health website, and you will find the information for a medical exemption and or a religious exemption. And so there's paperwork that has to be filled out and submitted back to us. So hopefully that will answer your question, but please, the vaccines are required. So we went over the 4 vaccines that are required: tetanus with pertussis, meningococcal, varicella, which is chickenpox, and measles, mumps, and rubella. Those 4 vaccines are required for all incoming students. So we want you to get those vaccines prior to your arrival at UC Merced. COVID is also a required vaccine, so we would like to see you fully vaccinated before you're on campus.
Thank you, Michelle. And real quick, while we have you, do have a couple questions about what does fully vaccinated, what is our definition of being fully vaccinated?
For COVID-19, it means the primary series, so either J&J plus a booster, or the mRNA, so Moderna or Pfizer, 2 doses of that plus a booster. The current UC, the University of California Office of the President policy for COVID vaccine is a fluid document. It asks that you continue to get the booster or follow the recommendations. And right now, for students, that's a primary series, and a booster is considered fully vaccinated.
Perfect. Thank you very much, Michelle. Question for Crystal. For those that do have a Medi-Cal, can you go over what the 2 cards that you said early on that the students or their family members may have?
Yes, absolutely. So the 2 cards that you will have to upload to the waiver is number 1, your plan card. So depending on what county you live in, for example, let's say you're in LA County, you would upload your LA Care card. So depending on what insurance you're under LA Care, so it could be LA Care Anthem Blue Cross, LA Care, I believe United Healthcare is another one, or LA Care Kaiser. And then the second card you will upload is your Medi-Cal benefits card. So it could be blue and white, which has the state seal on it, or it's a colored card that has the state flower, which are orange poppies. Those are both cards that are needed to be uploaded for the waiver.
Perfect. Thank you very much. So I put this question out to the panel. What would happen if a student has an emergency outside of the hours that the Student Health Center is open?
We have the after-hours advice nurse. It's a registered nurse that takes all the calls whenever we're closed, and then we get a report the following day. The number there is 209-228-2273, option 1. and it's anytime we're closed. So it's after hours, weekends, holidays. You call, and we will follow up the next time we're on duty. They will give you advice regarding your concern, your question, and they will make sure that they answer everything before they hang up on you or whatever other. They'll make sure to answer any concern or question.
And Rosie, while we have you, if it may be something that the student feels may be more urgent than calling into the nurse line, are there any other options available?
Yes, Merced Medical Center has an ER. It's 5 minutes away from here at UC Merced. They're available 24/7 for any student healthcare need.
Perfect. Thank you very much, Rosie.
You're welcome.
So for those of you that have just joined us, please, we do have the ability to answer your questions live. You can submit those down below through the Q&A panel located at the bottom center portion of your screen. We do have the screen up here. I have seen a couple questions come up about how to switch your Medi-Cal county. That information is posted here on the screen for you. And then here in a few minutes, Amy will switch back to the screen with the QR code. That is a link to all of our previous webinars that we have done throughout the summer. You can also find all of our webinars that we have done throughout the previous year at that link as well as any of the future upcoming webinars that we do have throughout the remaining summer before classes start in August. I guess a question for Crystal, I've seen this come up a lot with Kaiser Insurance. Can you go into, or we're able to go into a little bit more about what families with Kaiser Insurance need to do for our area?
Absolutely. So if you have Kaiser through an employer plan, all you would need to do, for example, if you're in Southern California, you would need to call Kaiser. So it's the member service number on the back of your card, and just let the representative know that your student will be attending UC Merced, which is in Northern California. And what they'll do is they'll actually give you a temporary Northern Kaiser number. That number, the student will be able to use at either the two Kaisers that are within the 55-mile range of campus, which is either Fresno or Modesto. And they can get their health, whatever they need done to see a doctor, primary care, anything they would need, they can go to either Fresno or Modesto. Now, if you have Kaiser under Medi-Cal, you will have to change your county to Merced. Unfortunately, Kaiser Medi-Cal falls under the Medi-Cal guidelines, and you have to change your county in order to see a doctor here in Merced, number one, and number two, you would have to switch your county in order for your waiver to be approved.
Thank you very much for that, Crystal. And while we still have you, a question actually did come up in the Q&A panel that I didn't think of. So for a student that does need to switch their Medi-Cal county, let's say they were to get that in tomorrow, and it does take up to 30 days, and that's past the deadline. What should the student and the family do at that point while they're waiting for the Medi-Cal county to switch?
What I recommend is that the student submit the waiver with the insurance information that they have now. What that'll do is that'll give them, for example, say they did the switch today and it takes, let's say 7 days. So, let's say it's close to the 1st that the change has happened and they need that letter. If they contact us and let us know, hey, I've changed my county almost 2 weeks ago. It's barely showing up now, and I've already requested that letter of eligibility. As of the day that they submitted their waiver and they got that denial, they have 14 days to appeal. So they have those 14 days to submit the documentation that they need. Unfortunately, if it goes past those 14 days, we cannot do anything and the status will stay denied.
Perfect. Thank you very much for that, Crystal. And if our families and students that are on the webinar need to get more information, what is the website that you want them to go to or the phone numbers to call?
So the website they can go to is health.ucmerced.edu, and we are under the insurance tab, and we have a how to waive tab that gives you the information needed for Medi-Cal, the mandates put in place for the waiver. All the information is on there, or you can reach out to us at our email address, which is insurance@ucmerced.edu, or you can give us a phone call, and please leave a voicemail, and it's 209-228-2273, option number 1.
Thank you for that. And for our students that may be applying for the UC SHIP waiver, how do we communicate back to them if their waiver has been approved or denied?
They will get an email that will be sent to their UC Merced email address. So after they submit it, let's just say 5 business days later, they get an approved letter that'll say your waiver has been approved, and that approval is good for the entire academic year. So that's good for all of 22-23 school year, and you won't have to apply for a waiver until fall of 2023. If it is denied, same thing, the email will go to your UC Merced email address, and it'll say your waiver was denied, and it'll give you the reasons why. So if that's the case, again, you can contact us and we can see why it was denied and help you to try to fix it.
Perfect. Thank you very much for that. Question for Dr. Brinkoff. There are some questions in the Q&A about the waiting periods from the time the student has their second dose of either the Pfizer or the Moderna to when they need to get their booster. Is there any, what is the current guidance for that for the students?
So I just answered one of those questions in the chat. So if you're waiting to get your booster, my recommendation is to get it as soon as you're eligible. And so if you're not going to be eligible until after school starts, that's fine. Just give us a call once you get here, and then we will we'll have vaccine at the health center. You can come in and get your booster. I saw another question about a second booster as well. Currently, the second booster, the current guidelines, second booster is only for people who have health conditions, immunocompromised, and older individuals. So if you fall into that group, then absolutely follow the guidelines for the second booster. If you don't, you're not going to need a second booster unless that becomes a mandate. Hopefully that will help.
Thank you very much for that. So question for Crystal. So if the student is denied for their UC SHIP waiver, what other options do they have? It looks like this question, they contacted their HMO and they were sent a list of doctors within the 55-mile requirement. They chose someone from that list and they were still denied. I know each of these may be unique situations, but what can the student and the family member do?
In that situation, what I recommend is they email us, and just in the email provide their student ID number and the reason their waiver was denied, and we can look into it and see what happened. We should be able to help them to see if we can get approved.
Perfect. Thank you very much for that. And then a question in the Q&A, can the student upload their virtual vaccine card to show proof of the first 3 shots if the physical copy was destroyed?
So this is Dr. Brinkup. A virtual vaccine card, not entirely sure what that is. If that's a picture on your phone, yes, that would be fine. You need to enter the dates of your COVID vaccine plus your booster. And then if you can upload a picture or whatever it is that you have as a virtual card, we can take a look at it and that should work.
Perfect. And then I can also know that the state of California, you can also sign up for your digital vaccine card through there. And I have that in my Apple Wallet. I'm sure you can also put that in the Android wallet as well. And that serves as a copy of your card as well. I got a question for you, Dr. Brinkoff. So if a student or one of the students in their residence hall contract COVID, what are our protocols for the fall?
So that's a great question. So if you or your roommate contracts COVID, we have testing available in the dorms. We have self-administered testing, so you would be able to test. If you tested positive, we'll have you do two things. You'll get a QR code with the test, and you can notify what we call the COVID Response Center. That will put in place a whole series of things to get you moved into an isolation dorm space. The isolation dorms are on campus. They are just regular dorms where you'll be able to isolate. If you have COVID, you'll be able to isolate away from other people who do not have COVID. You'll have your meals delivered to you, and we make the process as easy as we can. If your roommate tests positive, they'll be moving out and you'll be able to stay in your dorm if you've been fully vaccinated. There is no longer a quarantine requirement. So if you've been exposed to COVID and you are fully vaccinated, you won't have to quarantine. You'll be able to monitor for symptoms. You'll be able to do self-administered tests to make sure that you don't have COVID, but you won't have to quarantine or stay in your room. You'll be able to go to class and do the things that you need to do. So that's different than isolating if you test positive for COVID. But we do have those protocols in place. And I think we do a very, very good job of moving students to the isolation space, making it as easy as possible, making sure that our students have access to all of the items that they need while they're in isolation, including medical care. You're always welcome to come to the Student Health Center. And I think, as Rosie mentioned, we have an advice nurse for after hours questions. And then Student Health sends out a survey if you're in isolation, and our nurses follow up with you to get you cleared out of isolation as soon as possible and to work with the COVID Response Center to get you back into your dorm space.
Thank you very much for that. Dr. Brinkoff, do you have a couple questions about the tuberculosis? Is that the tuberculosis skin test to show a negative test as the requirement? Or is it, what exactly does the requirements for tuberculosis on our campus require?
Okay, so that's a great question. It depends on your TB screening. So all of our incoming students have to do a screening questionnaire. So if you do that questionnaire and you are not asked for any further information, you're done. If you do this questionnaire and you've had some kind of risk for tuberculosis, so maybe you were born outside of the United States, maybe you lived in a country that is tuberculosis is endemic, maybe you've been exposed to somebody who's had tuberculosis, whatever the risk may be, then you'll be required to show a negative test. We accept either a skin test, something called a PPD or a TST. So you can show us a copy of the negative skin test, or you can do a blood test. We will take either one. There are certain reasons why you might want to do the blood test, especially if you were born outside of the United States. If you had a vaccine called BCG, then we would recommend that you get the TB blood test and submit that. For specific questions, we're happy, just give us a call at Student Health or send us a message through your health portal and we can give you guidance, but we will accept either one. Thanks.
Well, thank you very much for that. We are coming to the end of our webinar tonight, so if you do have any last minute questions, feel free to put those into the Q&A panel at the bottom of the screen. Just want to put a plug out there for our admitted.ucmerced.edu website. You can find all of our past recordings of all of our webinars. Find a webinar recording of this webinar, typically posted 2 to 3 days after the airing of this. You can also find information about all of our future webinars as well, the webinars that we do have planned coming up for the rest of the summer. I do know we are working on a webinar directly with our housing team about what to expect at move-in this year. So you don't want to miss that one. Make sure that you do register for that one, because that one will contain a lot of great information. Also, if you do have questions about anything else, please do not hesitate to contact our Students First Center. I know all of our team down there, and they are an amazing group of people. You can scan the QR code in the bottom left portion of your screen, or you can also visit them at studentsfirst.ucmerced.edu or by calling 209-228-7178. A question for Dr. Brinkoff. The TB blood test is recommended, but it's not required, correct?
Correct.
Well, perfect. Again, my name is Adam Miller. I'm the Assistant Director of Event Operations here at the University of California, Merced's Enrollment Management Department. On behalf of everyone on the screen or behind the screen tonight, we'd like to take a moment and thank you for joining us tonight. Lots of great information. I've learned lots of great information about our campus. If we can be of any assistance, please don't hesitate to contact us. And we look forward to seeing you here in just a couple weeks at Move-In. Thank you. Have a wonderful evening.